Hi, my name is Nikki Verheyen and I will be doing a drug administration video. Today I have Claire as my videographer and then Blaine as my evaluator. So before I would even enter the patient's room, I would go over the history of why the patient was administered and then go over the provider's orders for the medications that are to be administered today. So I would grab the clipboard and then check the provider's orders. So here we've got Wheeler Jamie and date of birth 10/31/1947. So the medications that are ordered by the provider are digoxin 250 micrograms by mouth once daily, and it should not be given if the heart rate is less than 60, but we see in the scenario that the patient's heart rate is 79, so we will be administering digoxin today. Vitamin B12 injection is also ordered. It's 1,000 micrograms IM once now. And then we've also got Levemir, which is an insulin, 10 units subcutaneous once daily. So as I look at the provider's orders, I will also check for any implications of why the patient may not be able to take the medications, such as any allergies. We see that here on the provider's orders and the MAR that there is an allergy for codeine. So if it was to be ordered, we would not administer it due to the allergy. We would also check any labs or anything that would contradict the patient from taking any of these medications. I would cross-reference the MAR to the provider's orders and just ensure everything is correct. The right patient, right medication, right dose, right time, and right route that the medication is administered. So I would check all of that, and then I would gather the materials for the medication. And then here I would cross-reference the materials gathered with the MAR. So we've got digoxin, so that is oral. So we've got this, it is 250 micrograms. The medication here is 0.25 milligrams. This is the conversion that is correct. So we've got that. We will grab a cup for it to go in, and then water for the patient. So we've got that, and then we have 2 bottles. So we've got the vitamin B12 injection, 1,000 micrograms per milliliter. So, and it's 1,000 micrograms, so I would administer 1 milliliter. And I would also check the expiration date of both. So it's 2036 and then 12/20/30. So these are both able to be given. And then I also have the Levemir, which is here, 100 units per ml, and 10 units are ordered, and the expiration is also 12/20/30, so that checks out. I would gather the correct syringes as well. So the vitamin B12 is only 1 milliliter, so I would grab the 3 ml and a blunt tip for that. And then I would also get the insulin. This is only for insulin syringe. And then I would also gather a 25 gauge 5/8 inch for this. And then I would get the alcohol swabs for the medication bottles and for wiping the patient. And I would just cross-reference, make sure I have everything. So I've got the dioxin 250, yep, 0.25 milligrams. I have the vitamin B12, correct syringes, and the Levemir, perfect. And then I make sure I have everything. Then I would enter the patient's room. I would knock, introduce myself. Hi, my name is Nikki. I'll be your nurse today, and I'll be administering your medications that have been ordered by the provider. I would ask for their name and date of birth, and I would check their patient identifier, make sure it checks out, yes, and that's also the exact the paperwork. And then I also noticed there's an allergy band, also checks out with the codeine allergy, and I would just assess the patient, make sure they're okay, that they can take the medication. And as I administer, I would also check the MAR as I do it. I would grab my gloves, make sure that the patient is comfortable, and privacy is provided if needed. and I would explain to the patient which medications I will be administering and why. So we have digoxin, and your levels were 0.5, which is considered low/normal. And then I just have this over here as well. So I would first ensure that the patient can take medication orally safely and they can do it by themselves. I would put the patient in the correct position, so an upright position, and just sit them up correctly if they need to be, and check one more time. Yes, this is dioxin, 250 milligrams heart, and then I would give the medication, make sure they can take it, give the water, and then ensure that the patient did swallow the medication, and then just assess their reaction to it. And then I would have explained that the dioxin is for heart failure, and the patient has a history of heart failure, and that's why it was administered. And then some side effects just to go over would be anorexia, nausea, vomiting, fatigue, or bradycardia. So that's something that they can let me know if they're experiencing. Then I have the B12 vaccine injection, and I would get that ready. So I would first swab the alcohol, clean that, and let that dry. Get the syringe ready. And then B12 is administered intramuscularly, so that could be the deltoid, vastus lateralis, or ventrogluteal, which is the preferred site if this wants to open. I'm sorry.
You got it.
Oh my gosh. My gloves are too big. There we go. Twist it, ensure that the needle is on there, and I would make sure, yep, vitamin B12, and then 1,000 micrograms, and 1,000 is 1 milliliter, so I would pull down, make sure that's correct. And then keep it at eye level. Pull it down, make sure there aren't any bubbles at the bottom. Perfect. Good. And then I would get this ready. Perfect, and then I would have someone assist me in moving the patient so I can get to the ventrogluteal area. Perfect, and I would first swab the patient. I would find the right spot. Go right here. And then since it's intramuscular, I would do the Z-track technique. So pull away and then administer medication slowly. And then hold for 10 seconds. Perfect. And then for safety, and then right to the sharps, and then put the patient back. And then the B12 injection was for B12 deficiency. The patient exhibited low hemoglobin count, which was 10, and then the hemocritic of 30%, which is low, so that's why the B12 was administered. And there are common side effects just of pain at the injection site, so I would just ask the patient how they feel and make sure they're okay. Then I would get the Levemir ready. I would swab it, and since Levemir is considered a high alert drug, I would get a second RN to check the dosing and the medication, making sure I did it correctly before administering it to the patient. And then, so I've got Levemir, yes, 10 units, subcutaneous once daily. All right, so I have the right one, and it's 10. And I have the correct syringe. Perfect. And then I would have my fellow RN check the medication.
Check the MAR, see 10 units, and then our check. 10 units, perfect.
All right, and then this is a subcut injection site, so it can be either administered in the fatty part tissue of the abdomen, the back of the scapula, the upper arms and thighs, and then the upper ventrodorsal gluteal, but I will be administering the insulin 2 inches away from the umbilicus on the abdomen. So I would this, the belly, and just swab the site. And then, so 2 inches away, and then I would pinch at the site. Slowly administer. Wait 10 seconds. Pull. Perfect. And then right into the sharps. And I would discard everything necessary. And I would take the used vials to the used vial box of the medications. I would just assess the patient, the reactions. I would debrief the patient why the medications were administered. So the last one that was administered was the insulin, Levemir, and that is to control hyperglycemia. The patient's scenario, the blood glucose levels were at 132, so that is high on the levels, and then the side effects of this medication would be hypoglycemia, that it would lower it too much. So I would just assess the patient, make sure they're okay, comfortable, put the patient back in the position that they would want to be, just make sure everything's okay, safety-wise, and that they're good. I would don my gloves, wash up, and then leave to go document. And as I document, I would go over how the patient tolerated everything. I would also chart the medication, the dose, time, and the route. So the digoxin was given by mouth, the vitamin B12 was given the right ventrogluteal area, and then the Levemir was administered on the left side of the abdomen. And